Thanks. Well, we know that cases of COVID-19 are surging both here in Oklahoma and across the country. So in the past, the rate of kids getting sick or having to be hospitalized was lower than adults, right? But how do these stats hold up with the Omicron variant? Here with us now to discuss this is Dr. Cameron Manter, OU Health's Chief Medical Officer. Welcome to the show, Doctor.
Thanks for having me.
So I just want to get right to it here. Are we seeing more kids hospitalized with COVID-19 now than we did previously here in Oklahoma and around the country?
We definitely are. Back in the first surge, back last winter, we would average maybe 5 to 10 pediatric patients in the hospital due to the virus. And as of today, we've got between 20 and 25 kids in the hospital because of the virus.
Now, do you attribute that to the Omicron variant in particular, or what do you think?
We think that the majority of our patients being admitted today are due to the Omicron variant. There is still some Delta in our area, so it's a combination of both. But the admissions are certainly up within pediatric patients as compared to before.
Now, is there an age group in particular that are seeing some of the most numbers being sent to the hospital?
Not particularly. We've had patients 2 weeks of age up through teenagers. So it's pretty much across the board.
Okay. So in the grand scheme of, how many overall cases we're seeing, because we're seeing a lot, are the hospitalization numbers still relatively low? Give me some perspective here when it comes to our kids.
Sure. So if we look at the state in general, back last winter, I think our highest average daily cases were just over 4,000. That dropped down to about 2,700, and now, as of just a few days ago, it's up over 9,000. So the number of cases have gone up substantially. When we look at our institution as a whole, we had a maximum of maybe 160 patients in the hospital due to COVID, but only 5 to 10 of those were pediatric patients. That's now around 100 patients in total, and about 25 of those are pediatric patients. So we're certainly seeing more children admitted to the hospital than we did in the previous early on and then the Delta phase.
Now, when you are seeing these pediatric patients get admitted to the hospital with COVID, tell me what's going on with them. Are they most of the time coming out of it? Are they being put on ventilators? Walk me through what you're seeing.
So we have had very few patients have to be on the ventilator because of COVID. Some do have to be in the ICU because of oxygen requirements and pulmonary therapy that needs to be given to them. But thankfully, the majority of them are recovering from the virus and being sent home. But they are having to be admitted to the hospital because of respiratory disease that can't be cared for as an outpatient.
Sure. Okay. So with that being in mind, what is the biggest cause for concern here at this point?
Our greatest concern at Oklahoma Children's Hospital is the fact that we're having to take care of patients that can't be cared for elsewhere in the state, and our bed status is very tenuous, and that's because we've lost staff. We've lost respiratory therapists, and so it's becoming incredibly challenging for us to take care of all the other patients, the other pediatric patients that we need to take care of. So we're cutting back on surgical services. We're cutting back on elective admissions so that we can continue to take care of the sickest kids that need our help.
Sure, it's that ripple effect there. Okay, so we know at this point kids 5 to 17 can get the Pfizer vaccine under that emergency use authorization. Is getting that age group vaccinated really the only way to prevent these hospitalizations, do you think?
It is. There's no question. The vaccine is still very effective, and it's very safe. It's not 100% protective. We've seen breakthrough cases for both pediatric patients and adult patients, but we know that the severity of the disease is still substantially less if you're fully vaccinated.
And kids under 5, what do you think is next for them being vaccine eligible?
We're still waiting on the trials to tell us. I think things are encouraging, but I do not have a timeline yet for when we think that we might be able to vaccinate our less than 5-year-old kids.
And last question here, really just to wrap it up. I mean, what would be your message to parents right now in this latest surge?
It's we're still struggling with controlling the spread of the virus. We've got this new variant. There's another one coming out in Europe that we know less about. We do think that although Omicron appears to be very contagious, that hopefully its longevity will be quick. We're not seeing the mortality with it that we saw with the virus early on, but still for parents, being careful, washing your hands, wearing masks, doing everything we can to do to prevent the spread of typical respiratory viruses, and making sure that you can get your children vaccinated when it's available. It helps both the spread within your family and to grandparents and those that are more susceptible. So being careful, wearing your mask, and absolutely get vaccinated as quickly as you can.
All right, Dr. Cameron Manter with OU Health. Thank you so much for coming on today and lending your expertise. We really appreciate it.
You're very welcome.